First of all, welcome to VON. I loved this plan. I would say that it's a very good start, and I would say what I'd like to see is incremental increases in the tax breaks, but this is an excellent start. I have worked in cancer care for a long, long time, and part of the issues with families caring for people in the home are the medication costs. Can you tell me how your party would address the horrendous medication costs for people in caring in the home?
I like Scott's finance critic and to comment on this as well. What we see across the country is home care is the next frontier, and pharmacy, drug costs are the other one. We go into 2014 and renegotiate the health care accord. We can't avoid that conversation. What we see, and I'm not an expert, everybody in this room will probably know more about this, county, region by region, province by province than I do, is wide variations in the kinds of coverage that are available, depending on who you are, depending whether you're retired, depending whether you're senior, which province you're in. All I see as a politician is that there's a patchwork here, but we're all Canadian citizens. If we were committed in the Canada Health Act to universality, we don't have universality in this dimension. There's some provinces that do not have catastrophic pharmaceutical drug coverage that is adequate. We need to work with the provinces to figure out where the gaps are and begin to fill them. I'm resistant to a big, heavy-footed federal pharmacare program. Let's all keep firmly aware that we're in a $56 billion hole. I didn't dig you in there, by the way. I'm not here to make partisan politics, but I just observe. Didn't dig you in there, and I got to dig you out. Scott and I got to dig you out, okay? But we do think that, to get back to a fundamental issue of principle, none of us in this room fought 60 years to make sure that access to health care shouldn't depend on your wallet. We don't want to have a healthcare system where access to drugs is dependent on your postcode. See, that's the issue that's concerning me. We don't want to duplicate. We don't want to have come in and have the federal government duplicate what provinces are doing, because we can't afford to do that. We got to pick where the gaps are here, work with you to figure out where the gaps are, and start to get that pan-Canadian approach to drug care costs that saves families from bankruptcy, ruin, and financial disaster, which is what I see. I don't know whether Scott wants to add on this or not.
The reality is that in provinces like Nova Scotia, without a catastrophic, what it means is that people don't or can't pay for those drugs. They often end up in the hospital, and that's the only place they can get the care they need. That costs the system a lot more. So there is a role for a federal government in working with provinces, identifying those gaps and filling them. In the same way as we approached the 2014 in this discussion, a federal plan that helps more Canadians stay at home and live in their homes is going to save the provincial governments a lot of health care costs, keeping them out of the hospitals, out of the nursing homes in some cases. So I think there's a really important discussion about how what we do is not only really important and innovative social policy, but it's good economic policy as well.
Not to mention, if I could just add finally, there are potential benefits that everybody can see if we have drug purchasing for 33 million Canadians as opposed to micro buying for micro markets. There may be some significant economies of scale if we can get this right. Let's not promise what we can't deliver. I'm just saying everybody can see that. How do we do that is another matter, and we got to get all the details right. Sir.
Mr. Representative, I'm Neil Stewart. I'm a board member from Ontario. Thanks so much for joining us and for your comments. I wanted to pick up on your comment about the home as the next frontier and ask you a question that focuses on sort of technology and technology infrastructure. In years past, we've seen huge investments in government sort of priorities to getting the infrastructure in there to wire and connect our society and our economy. Have you given any thought to the possibilities and the opportunities for getting homes better connected to allow us to put more telemonitoring kind of technology and take advantage of some of the opportunities that are clearly there if the infrastructure can support it, to give much more care to people in their homes?
I think that's an excellent point. When I say, and we say, health starts at the home, you see it every day in the home in Canada already. That is, when my wife her mom is 88 years old, and the doc comes to see her, and the doc will prescribe a medication. First thing my wife does is goes online, checks it out. She wants to do she's the second opinion. This is great. That kind of health information in the home is delivered because we have access to high speed. Just let me open a parenthesis, 800,000 Canadian don't have access to high speed. They've got lousy dial-up. One of the things that we've committed to as a party is to use the next sale of a spectrum auction to work with the private sector to get 100% high speed all over the country for rural, remote, and northern Canada, because we can't have equality in health unless we do. And one of the strongest public policy reasons for doing that, a part of its economic benefits, is precisely the medical benefits that you adduce, and we need to continue with InfoWay and the other federal investments that we've made here, and we can't let some of the difficulties that we've had in Ontario slow us down. There's absolutely no question that if the home is the frontier, we've got to get these technologies into the home, and they're fantastically powerful technologies for health education, for health information, for health monitoring, and we got to be there. And so I absolutely take where you're going, and as I say, we've made some significant platform commitments in terms of internet access for all Canadians. Let's have a question from the web.
Thank you, and just so everyone's aware, we have people joining us online at liberal.ca from all over the country, and they're sending in their questions and comments to our live blog, which you can visit afterwards, again at liberal.ca, along with an audio recording of this entire conversation. Everything that we're talking about here is being streamed live to VON members and members of the public all across the country. This next question came in through the liberal.ca live blog from Darlene Billard Croucher, who writes from St. John's, Newfoundland and Labrador. She writes, I recently had the opportunity to meet with Siobhan Cody in St. John's, Newfoundland, who was very interested in the programs and services offered by VON. How do our community members engage on bringing our ideas to local MPs? What is your advice?
Well, it sounds like she did a pretty good job engaging already. And I think these kind of live discussions are part of it. I think Scott and I both believe that the best way to engage is just to show up. I'm doing community town halls like this across the country. You'll be interested to know how central the healthcare debate is, how central the family care debate, how top of mind it is for Canadians. We're not talking about something that's just kind of out there. It's right in the middle of the pike for Canadian and Canadian families. So I hope that anybody watching this or listening to this conversation will contact their MP, whatever party. I hope that every citizen of our country will make healthcare a central issue in the next election. I hope we get granular about it. That is, how do we fix this? How do we make it sustainable? What programs work and don't work?